Hello everyone. I'm going to discuss with you today meningitis disease. What is meningitis? Meningitis is an infection of the membranes cover the brain and the spinal cord. This covering is called meninges. As you can see here in this picture, how the brain is covered with the three layers, which called meninges. And here you can see the three meninges in healthy person, and in this one you can see how it is the meninges is get infected and inflammation and swallow. What's cause meningitis? The most common causes of meningitis are viral infection. This infection usually get better without treatment, but bacterial meningitis infection are very serious. They may result in death or brain damage even if it is treated. Meningitis may also be caused by chemical irritation, drug allergies, fungi, parasites, and a tumor. Meningitis symptoms for viral meningitis occur more often than bacterial meningitis, and it is mild. It usually occurs in the late summer and early fall. It most often affects children and adults under age 30. Symptoms may include headache, sensitivity of light, slightly fever, upset stomach and diarrhea, and fatigue. Bacterial meningitis is an emergency. You will need immediate treatment in the hospital. Symptoms usually come on quickly and may include fever and chilly, mental status changing, nausea and vomiting, sensitivity to light, severe headache, stiff neck. How meningitis is diagnosed? Meningitis can be difficult to diagnose in the early stage because the symptoms can be similar to the flu. If your doctor suspects that you have meningitis, they may perform one or more of the following tests. Physical examination to check for signs of infection, lumbar puncture, the spinal tap should be done to remove small of spinal fluid, which is called cerebral spinal fluid, for testing. So as you can see here in this picture, how they can do the lumbar puncture as they are inserting the needle between the vertebra L3 and L4 through the spinal canal in the subarachnoid space. And for other testing, they may be also be done as a blood culture to check for infection, chest X-ray, CT scan of the head. Let's see what is the treatment for meningitis. Antibiotics are used to treat bacterial meningitis. Antibiotics do not treat viral meningitis, but antiviral medicine may be given to those with herpes meningitis. Other treatment will include fluid through the vein, intravenous, medicine to treat symptoms such as brain swelling, shock, and seizure. Complication. Without promoted treatment, meningitis may result in the following: brain damage, building of fluid between the skull and the brain, which is called subdural infusion, hearing loss, building of a fluid inside the skull that lead to brain swelling, which is called hydrocephalus, seizure, and death. How to avoid meningitis? You can reduce your risk to get of spreading virus and bacteria by taking a few precautions. Wash your hands frequently with the warm water and soap. Don't share eating utensil, straw, or blade. Cover your nose and mouth when you cough or sneeze. Stay up to date with immunization and shoot, booster shot for meningitis. Ask your doctor about immunization before traveling to the country with a high rate of meningitis. Thank you for your listening. And here it is some question if you want to take meningitis quiz so you can test yourself about information you get it from this presentation. And in the end, you can find the answer after you testing. Thank you for your listening.